Hello, my name is Annie Kleynerman, and I'm a second-year medical student at the Medical College of Wisconsin. To begin, I'd like to provide a little background about acid ceramidase deficiency and the disorder it involves, Farber disease. Farber disease is a rare autosomal recessive lysosomal storage disorder in which the ASAH1 gene is mutated and in turn results in acid ceramidase deficiency. Patients with classic Farber disease present with lipogranulomatosis, respiratory involvement, and neurological deficits, dying before the age of 2 in most cases. Upon histological analysis, many tissues in patients with Farber disease show ceramide accumulation, macrophage infiltration, and the presence of Farber bodies, an inclusion unique to this disorder. The heart is also mentioned in clinical cases. However, there's not much detail about its involvement, despite the heart's critical role in other lysosomal storage disorders like Fabry disease. In the past, the Medin lab has studied Farber disease in their mixed background ASAH1 mutant acid ceramidase deficient mouse model. In this older mouse model, they were able to find preliminary evidence of cardiac involvement. However, specific and long-lasting effects of acid ceramidase deficiency on cardiac function and development had not been investigated. In this study, the previous mixed background Farber mouse was bred into a Black 6 line in order to have a more representative, pure Black 6 control. As this mouse is entirely novel, general characterization was needed. As seen in Figure 1, novel Black 6 ASAH1 mutant Farber mice weighed significantly less than wild types and had shortened lifespans of only 7 weeks. Gross pictures were taken of the mice and their hearts. You can see that the Farber mouse on the bottom in Figure 1D is much smaller than its wild-type littermate on top. Similarly, in Figures 1E and 1F, the hearts are shown to be statistically different in size, with the wild-type on the left and the much smaller Farber on the right. Furthermore, cardiac troponin, a clinically relevant biomarker of cardiac stress, was measured. Farber mice had significantly more cardiac troponin in their serum than their wild-type counterparts at 7 weeks, as seen in Figure 1C. CBCs were done in peripheral blood at 3, 5, and 7 weeks. The results in Figure 2 show significant microcytic anemia and leukocytosis in the Farber mice, most notably at 7 weeks. We also did functional echocardiography analysis seen in Figure 3. Hearts of Farber mice had statistically impaired function, characterized by bradycardia, decreased ventricular thickness, valve stiffening, lowered stroke volume, and smaller cardiac output. Histology was done to assess pathology in Farber mouse hearts. As shown in Figure 4, H&E staining revealed cellular disarray. 2 images are shown of different regions in the same wild-type and Farber mouse heart stained with Mason's trichrome. Mason's trichrome showed interstitial fibrosis in the left ventricular region as shown by the black arrows, and perivascular fibrosis in the mid-myocardial region as seen by the white arrows. Cathepsin D was used to stain for lysosomal proteases and revealed increased staining in Farber mouse hearts. Lastly, elevated infiltrating macrophages were shown in Farber mouse hearts using antibodies for MAC2. Electron microscopy was used to further investigate Farber mouse hearts for the Farber bodies seen in patient tissues. Figure 5D reveals infiltrating macrophages in the Farber mouse heart tissue, as seen by the red arrow. And within the macrophage cytoplasm, white arrows point to the Farber body inclusions that are discovered in Figure 5F. Increased cytoplasm was also seen in Farber mouse cardiomyocytes, as seen in Figure 5E. These data allow us to conclude that the hearts of our novel Black 6 acid ceramidase deficient mice have impaired cardiac function as well as pathology. Future directions include measuring acid ceramidase activity in the heart tissue, quantifying ceramide accumulation, and histologically assessing for lipids, vascularization, and cardiomyocyte size. Our next goal is to elucidate the mechanism of acid ceramidase's involvement in the development of the heart. A final special thank you goes out to Dr. Medin and his lab, Dr. O'Meara and her lab, the NHLBI, Children's Wisconsin, the MAC Fund, and MCW for this wonderful opportunity.